Now let's move on to the perinatal infection. Many of the viruses we have already discussed. We have discussed about varicella, we have discussed about rubella. So all these varicella, rubella, especially these two viruses were teratogenic. Similarly, herpes, when pregnant woman gets infected with the herpes simplex infection, it affects or it gets transmitted through transplacentally and causes predominantly 3 different modalities of infection in the newborn. So number 1 is a SEM disease. SEM is skin, eyes or mouth. Okay. So skin, eyes and mouth. This is number 1. Number 2 is skin, eyes and mouth with encephalitis, or sometimes only encephalitis without the skin, eyes, mouth involvement. Third will be the disseminated infection. So skin, eyes, mouth, that is only the mucocutaneous involvement, that is the most common. So 40% of the newborns will have SEM involvement. Encephalitis will happen in around 30% of the individuals, and the other 30% will have disseminated infection. But whatever be it, a mother who has acquired HSV infection during the pregnancy, or if there is an HSV infection around the time of the birth, it can get transmitted transplacentally also. It gets transmitted during the birth process, that is in the intrapartum period also it gets transmitted. We have to be very careful. We should be aware of this 3 different types of infections: SEM, encephalitis with or without SEM, disseminated infection. So SEM usually occurs pretty early. In the first 1 week itself, you will be able to find that there are many ulcers. Skin, eyes, mouth, there will be ulcers. Okay, so first week it will be present, vesicles. Encephalitis is present in the 2nd week of birth. Vesicles will not be seen much, but it is a encephalitis picture. Only 60% there will be vesicles. Disseminated infection occurs again at the end of first week. So disseminated means most of the organs are affected. Brain, lungs, liver, heart, adrenal, skin affected. Skin vesicles can be seen in 75%. The mortality is highest in this disseminated stage. 90% of these children will die in the disseminated stage. 80% of the children in the encephalitis category will die if left untreated. So high index of suspicion is needed. A very careful antenatal history. If the mother had any history of fever, any rash, any vesicles, oral or genital, this history is very, very important. So coming to the diagnosis of herpes simplex, in clinically we do this HSV viral DNA PCR. Viral cultures are all only of theoretical use. Okay, we do only the HSV viral DNA PCR. This is done from the samples from CSF. It is done from the samples from the mucocutaneous lesions. So next coming to the HSV encephalitis. So any newborn you suspect of HSV encephalitis, or in any child you suspect of an atypical picture. You get a child with acute febrile encephalopathy, you think of HSV encephalitis, do a CSF, send it for CSF, HSV DNA PCR, do a MRI. MRI will most probably clinch you the diagnosis of herpes encephalitis because of the typical areas which are involved. I told you already, the limbic system, temporal cortex, some parts of frontal cortex. These 3 are the important areas which are affected in herpes simplex infection. So classically here you can see that the medial part of the temporal lobe in the right side is affected. So early white matter changes. It is a necrotizing infection. So you will see a lot of edema. Early white matter changes will be present. Hemorrhage also can be sometimes seen. Okay. So these are the typical areas. Temporal lobes, white matter lesions will be there. There will be hemorrhage. So limbic system is involved. Basal ganglia will be typically spared in the one of the encephalitis where we see typical basal ganglia involvement is Japanese encephalitis. So typically the substantia nigra, thalamus typically will be involved in basal ganglia. So Japanese encephalitis is for basal ganglia. Here basal ganglia is typically spared. So there can be sometimes atypical pattern also, not just restricted to the limbic system, temporal cortex. If the child is very severely malnourished or immunocompromised, it can involve the generalized parenchymal lesion can be there. Even the brain stem or cerebellum can be affected. Not just the cerebral cortex, but even cerebellum or brainstem can also get affected. But it is only in the immunocompromised individuals.